prevent breaches. Physical safeguards protect the environments where data is stored or accessed. This can mean controlling facility access, securing servers in locked rooms, using surveillance systems, and ensuring workstations are positioned to prevent unauthorized viewing. It also covers policies for handling hardware, like secure disposal of devices that contain patient information. Technical safeguards ensure the electronic protection of health data. This involves encryption, secure user authentication, automatic log-off systems, and audit controls to track who accessed what information and when. These safeguards also include measures like intrusion detection systems and secure transmission protocols to prevent data from being intercepted. Together, these three safeguard categories form the foundation of HIPAA compliance, ensuring that patient information remains confidential, available only to authorized personnel, and protected against both accidental and intentional misuse. What is GDPR? The General Data Protection Regulation, or GDPR, is the European Union's comprehensive legal framework for protecting personal data. It applies to any organization, anywhere in the world, that collects, processes, or stores the personal information of EU citizens, making it directly relevant to healthcare providers, insurers, and health technology companies. In healthcare, personal data extends beyond basic identifiers like names and addresses. It includes sensitive health information such as medical histories, diagnostic images, genetic data, and treatment records, all of which receive the highest level of protection under GDPR. The regulation emphasizes transparency, meaning organizations must clearly inform individuals how their data is collected, used, and stored. Consent must be explicit, freely given, and documented, especially when dealing with health data. Patients also have strong rights over their information, including the right of access, to see what data is held about them, and the right to erasure, sometimes called the right to be forgotten, allowing them to request deletion of their personal records. GDPR also requires robust security measures, such as encryption, access controls, and regular risk assessments, to protect data from breaches. In the event of a breach, organizations must notify both authorities and affected individuals within strict time limits. By enforcing these principles, GDPR ensures that individuals retain control over their personal health data, while holding organizations accountable for its protection, strengthening trust in digital healthcare systems. Healthcare organizations manage multiple categories of sensitive data, each with unique vulnerabilities. At the core is protected health information, or PHI, which includes medical histories, diagnoses, treatment records, and test results, data that directly links a patient to their health status. Medical records form the backbone of patient care, containing years of health data, imaging results, prescriptions, and surgical histories. Closely tied to this is health insurance data, which holds policy numbers, coverage details, and claims information, often targeted for insurance fraud. Financial data such as credit card details, bank account information, and payment histories are highly valuable to cybercriminals seeking direct monetary gain. Personally identifiable information, names, addresses, phone numbers, and national IDs, can be exploited for identity theft and unauthorized account access. Demographic data provides insights into patient groups based on age, gender, location, or occupation, but in the wrong hands, it can be misused for discrimination or targeted scams. Beyond this, there are highly sensitive research datasets such as genomic data, containing a person's unique genetic blueprint, which if exposed, could impact privacy at the deepest biological level. Clinical trial data represents years of investment, innovation, and intellectual property, and its loss can jeopardize both patient safety and research credibility. Together, these types of data form the lifeblood of modern healthcare, and their protection is critical not only for legal compliance but for preserving patient trust, research integrity, and the reputation of healthcare institutions. Healthcare has become one of the most targeted sectors for cyber attacks due to the high value of its data and the life-critical nature of its operations. Among the most frequent threats is phishing, where attackers send deceptive emails or messages to trick staff into revealing login credentials or downloading malicious attachments. Once inside the network, attackers can escalate their access and compromise sensitive systems. Phishing attacks are a common cyber threat that target individuals and organizations to steal sensitive information. Let's walk through the process step by step. 1. Attacker initiates the attack. The attack starts with a malicious actor, known as the attacker, who prepares a targeted email. This is often called a spear phishing email, crafted to appear legitimate and convincing. 2. Bypassing the firewall. The email is sent to the target organization. It passes through the firewall, which is designed to filter suspicious traffic, but some phishing emails can still slip through due to sophisticated evasion techniques. 3. Email filtering stage. Once inside the network, the email is processed by email filtering systems, such as antivirus or anti-spam tools. If detected, the email is blocked. However, advanced phishing emails often evade these filters. 4. User compromise. If the email reaches the user's inbox and the user is tricked into clicking a malicious link or opening an infected attachment, their credentials or device can be compromised. 5. Sensitive data extraction. A compromised user may unknowingly provide access to sensitive data. This data can include personal details, financial information, or confidential company files. 6. Security tools and data exfiltration. Security tools like proxies, DLP, data loss prevention, and IDS systems are in place to monitor and prevent data leaks. However, if these fail, the attacker can exfiltrate the stolen sensitive data. 7. Cycle completes. The stolen data is then sent back to the attacker, completing the phishing attack cycle. This information may be sold on the dark web or used for further attacks. 8. Closing message. Phishing attacks rely heavily on human error, which is why user awareness, robust email security, and continuous monitoring are essential to defend against them. Ransomware is a type of malicious software designed to block access to a system or data until a ransom is paid. Let's break down how such an attack typically unfolds. 1. Initial contact. The attacker begins by sending a phishing email to the target. This email is carefully crafted to appear legitimate, often tricking the user into clicking a link or opening an attachment. 2. User interaction. When the user clicks on the malicious link or downloads the attachment, the ransomware file is introduced into the system. 3. Malware execution. The malicious file unpacks and executes itself, installing ransomware components into the victim's machine. 4. Key download from command and control server. The ransomware connects to a remote command and control server, often via an anonymizing network like Tor, to download a unique public encryption key. 5. File encryption. Using this key, the ransomware encrypts the victim's files, making them inaccessible. The user is then presented with a ransom note or ransomware screen demanding payment. 6. Ransom payment and communication. If the victim decides to pay, typically in cryptocurrency like Bitcoin, communication occurs again over Tor. The attacker then sends the private decryption key, allowing the files to be restored, though there's no guarantee the attacker will actually deliver it. This attack chain highlights the importance of phishing awareness, endpoint protection, and secure backups to defend against ransomware threats. Understanding your audience takes on a whole new meaning when dealing with insider threats. Here, our audience is the people inside the organization, employees, contractors, partners, anyone with legitimate access to our systems and data. 1. Awareness level. We first assess awareness. Do individuals understand security protocols, the importance of data protection, and the consequences of policy violations? Low awareness can make them vulnerable to exploitation. 2. Demographics. We review basic demographics such as role, department, and tenure. Certain roles, like those with privileged access, require closer monitoring. 3. Digital footprint and activity. We monitor digital activity patterns, logins, file transfers, use of removable media, or unusual access times, to identify potential red flags. 4. Behavioral indicators. Psychographic and behavioral profiling helps us spot changes in attitude, motivation, or engagement that might signal dissatisfaction or risky behavior. 5. Economic stress factors. Finally, we consider possible economic pressures. Financial difficulties can increase susceptibility to bribery, theft, or sabotage. By combining these profiling elements, security teams can detect early warning signs, intervene before incidents escalate, and strengthen defenses against insider threats. A zero-day attack is one of the most dangerous cybersecurity threats because it exploits a software vulnerability that is unknown to the vendor and for which no patch or fix exists. The term, zero-day, refers to the fact that defenders have had 0 days to prepare or respond to the flaw. Attackers often discover these vulnerabilities before the software developer does. They act quickly, designing malware, exploiting the flaw, and gaining access to systems before a patch is released. Once an exploit is in circulation, the attack window can be extremely short but devastating. Unpatched software, whether due to lack of awareness, delayed updates, or neglected systems, becomes the perfect target. Even after a vendor releases a fix, organizations that fail to apply patches promptly remain vulnerable, turning a zero-day risk into an open-door invitation for cybercriminals. The best defense against zero-day attacks is a layered security approach, proactive vulnerability scanning, behavior-based threat detection, intrusion prevention systems, and a robust patch management process to close known gaps as soon as updates are available. In May 2017, the United Kingdom's National Health Service became one of the most high-profile victims of the WannaCry ransomware attack. WannaCry spread rapidly across networks by exploiting a Microsoft Windows vulnerability, encrypting patient records, appointment schedules, and other critical healthcare data. Within hours, hospitals were forced to cancel thousands of appointments, divert emergency cases, and revert to pen and paper recordkeeping. This cyber attack was not only financially damaging, but it also put patient safety at risk by delaying treatments. The most alarming fact was that the vulnerability exploited had a patch available weeks before the attack, but many systems had not been updated, leaving them exposed. WannaCry became a wake-up call for healthcare systems worldwide, showing that outdated software and poor patch management could lead to real-world harm. The lesson learned? In healthcare, cybersecurity is patient safety. Regular updates, strong network segmentation, and staff awareness are vital to prevent similar disasters. In 2020, ransomware attacks crippled U.S. healthcare providers in a wave of unprecedented disruption. At least 92 separate attacks impacted over 600 hospitals, clinics, and healthcare organizations, compromising the personal records of more than 18 million patients. The collateral damage was staggering. Systems remained offline for an average of 15 to 21 days, with some organizations experiencing downtime that lasted weeks. One major health network reported operating losses and recovery costs of $1.5 million per day following the attack. Across the industry, the estimated total cost of downtime and recovery soared to $20.08 to $21 billion in 2020. The impact was more than just financial. Patient care was put at serious risk. Hospitals diverted ambulances, postponed surgeries, and reverted to paper documentation in the face of paralyzed digital systems. In 2021, HealthNet, a major healthcare insurance provider in the United States, reported a significant data breach that exposed sensitive personal and health information of thousands of individuals. The breach was linked to a cyber attack on one of its third-party vendors, highlighting how vulnerabilities in a partner's systems can cascade into large-scale data compromises. Stolen data included names, addresses, birth dates, insurance ID numbers, and in some cases, medical records. This incident demonstrated the importance of robust vendor risk management, encrypted data storage, and continuous monitoring of external partners. For healthcare organizations, the HealthNet breach serves as a stark reminder. Cybersecurity isn't just about protecting your own network, it's about safeguarding every link in the chain that connects to your patient's data. Even a single weak point can open the door to massive privacy violations and financial losses. This chart from the HIPAA Journal illustrates the top 5 sectors by the cost of cybersecurity breaches in 2023, based on data from the IBM Data Breach Report. The healthcare sector leads the list by a wide margin, with an average breach cost of $10.93 million, marking an 8.2% increase from 2022, the highest growth rate among all sectors. Next is the financial sector, where breaches cost an average of $5.90 million, up 1.1% from the previous year. The pharmaceutical sector follows, with breach costs averaging $4.83 million, reflecting a 3.8% increase. In the energy sector, the average cost is $4.78 million, a 1.3% rise compared to 2022. Finally, the industry sector sees breach costs of $4.73 million, with a significant 5.8% increase over the prior year. Overall, the data reveals that while all these sectors face high costs from cyber incidents, healthcare not only suffers the most financially but is also seeing the fastest rise in breach costs, emphasizing the urgent need for robust cybersecurity measures across the industry.